COVID-19 vaccination rollout, and lots of states have already opened up mass inoculation sites and expanded eligibility. But there's one big problem here. There is not enough supply of the vaccines themselves. The U.S. has been administering an average of about 1.7 million doses a day, but the country is facing a growing threat from virus variants, some of which are far more contagious and could be even deadlier. Well, we have Dr. Luiza Petre joining us. She's an assistant professor of medicine at Mount Sinai Hospital in New York. So first of all, tell us what issues health officials are facing in distributing vaccines right now. How limited is the supply, and why are these vaccines being thrown out at the same time?
Natasha, right now we have 70 million doses allocated. 52 out of 70 million doses already have made it to people's arms. The initial challenges were, as we know, the lack of infrastructure, asking the hospitals to take on this tremendous job, and a lack of staff and training. But those kinks have been ironed out, and now, as you said, we expanded to community centers. We opened stadiums and chain pharmacies for distribution. So we're definitely catching up, administering more vaccines. Now, the challenge that's coming is going to be the shortage, because we are facing a limited supply, as we know.
Why is it taking so long to distribute vaccines?
Well, it's a task that has never been done before. We do not have a centralized medical system like Israel has, like United Kingdom. So we do have a fragmented healthcare in the United States. So it took a while to put all these puzzles together. But Biden administration has created a very aggressive centralized federal planning that's helping. Invoking the Defense Production Act is definitely boosting the production from the manufacturer side. Also, they have a larger eye on the choking points when it comes to a supply chain.
Now, what are the vaccines that are currently available in the United States?
Right now, the main two vaccines approved by the FDA are Moderna and Pfizer, and we're looking very soon, like in early March, at the Johnson & Johnson. It's already submitted for approval, so we expect something end of February to come out and to roll out early March. That's definitely going to be making a huge difference. It's a versatile vaccine. It's easy to transport. It will likely make it to those remote rural areas.
Now, how worried are doctors about coronavirus variants, and which areas are most at risk in the United States?
In the middle of all this good news, definitely mutations are giving healthcare providers a pause. The concerns are that the new mutant variants will be more contagious and also trigger more severe disease. Right now, we are looking at the main strains coming from UK, South Africa, and Brazil. Definitely in Florida, 1/3 of cases right now are considered to be UK variant. But also, we have discovered 7 new homegrown variants, and now they have name birds. You'll hear pelican, mockingbird, robin variants. Not all of them are dangerous, but we have to keep an eye if they are becoming more contagious, more transmissible, and also the highest risk it comes if they will evade vaccines or testing. So the genomic sequencing in the United States have been ramped up, so we keep an eye on these mutations.
All right. Well, Luiza, thank you so much for joining us, and we'll probably have you back on soon to see what the update is on this. All right. We are moving on to